Welcome back to another Effective Cannabis Conversation. I'm Debi Wimberley, your host, and today we're diving into a topic that touches every woman, every family, and honestly, every healthcare system. We're exploring how cannabis and the endocannabinoid system supports hormone health across the lifespan with a special focus on perimenopause and menopause, and how this experience can look very different for women. Before we begin, I want to share that everything we discuss today is for medical awareness and educational purposes only, not medical advice. Our goal is to give you information so you can ask better questions, advocate for yourself, and make informed decisions about your health. I'm truly excited to welcome back Amanda Reiman. Amanda is the founder of Personal Plants and a leading researcher in medical cannabis, including its role in harm reduction and as a substitute for alcohol and other substances. Her work focuses on helping people build healthy, intentional, and empowered relationships with cannabis. Amanda, I'm grateful to have you here again. For anyone meeting you for the first time, can you share a little bit about your background and what led you to focus on the intentional intersection of health, behavior, and cannabis?
Well, Debbie, thank you so much for having me. It's great to be back, and I love our conversations. And I'm very excited about the conversation we're going to have today. As a 49-year-old woman, I think that we don't have this conversation enough. So I'm very excited about it. I've been studying cannabis for over 20 years, and my background really comes from understanding the impact that prohibition has had on our ability to learn about cannabis, to develop healthy relationships with cannabis, and the way that prohibition has impacted this kind of all or nothing thinking about cannabis, where you've got one side saying cannabis is the devil and it's the devil's lettuce and it's a gateway drug and it's, the same thing as heroin. And then you have another side saying it cures everything. There's no risk at all. You can use as much as you want. Nothing's going to happen. There's no such thing as overdose. There's no such thing as dependence. And I'm a trained public health researcher. So I'm looking at this from what does the evidence say? And I felt like there was really a need for somebody to come with not necessarily a voice of reason, but a middle ground, right? That says, yes, there are risks to using cannabis and we should know about them and we should account for them. And there are also benefits to using cannabis and we shouldn't downplay those. And so my goal is to help people understand what moderate consumption looks like, what a minimum effective dose is, how to tell if your cannabis use has become more mindless than mindful, and to really understand harm reduction from both sides. How do we use cannabis as a harm reduction tool to reduce the use of things like alcohol and other medications? And how do we practice harm reduction within the use of cannabis so that we're choosing methods of consumption that are going to be the most healthful for us, so that we're really using cannabis with intention. And my stance is that we have had relationship with cannabis as human beings for thousands of years, but we have never, ever, ever in the history of humankind had the kind of access that we have today to such a variety of products and potencies. And with that comes a great responsibility for us as consumers, for us as a society, to talk about what healthy relationships to cannabis look like. And that's really what I'm here to do, and to help people understand that it's just so much more than smoking a joint. There's so much to consider when you're trying to figure out what the right product is for you.
So beautifully put. And thank you for doing the work that you do because this is the conversations that we need to be having and we need to be exploring. Let's zoom out and look at women's health across their lifespan. Where do you see cannabis fitting in most meaningfully?
Well, I love this question because when I give talks, and especially when I was teaching, I used to teach at Berkeley, and my students were in their early 20s. And, cannabis was exciting to them. They were in Berkeley, California. They had access, they're young and they're excited about life. And what I used to tell them is that I get why you like cannabis as a young person, but cannabis will be most useful to you as an older person. And I still stand by that. And I think that cannabis definitely has value to people throughout their adulthood. But when we look at what happens as we age, right? So we have aches and pains, we have creaky joints, we have inflammation, we have trouble sleeping, we have mood disturbance. We have a lot of things that come on as older people that we did not necessarily deal with as younger people. And intersecting with that, we have a higher sensitivity to pharmaceutical drugs. We have a higher sensitivity to alcohol. And we need to make the best decisions for our health and well-being about how we're going to treat these oncoming issues that everybody experiences. And cannabis is so interesting because not only does it have a stellar safety profile, meaning that there's no such thing as fatal overdose, dependence is very rare. It also treats a myriad of conditions, which we're going to talk about, a lot of it related to endocannabinoid regulation. And it also helps the body maintain homeostasis or balance, which is something else we deal with as our hormones start kind of leading a crusade against us as we get older and really changing in how they're regulated and how they're produced. So I think, especially for women, cannabis is most useful as we get into our 40s and beyond.
I had a total hysterectomy at the age of 25, and I went into full-blown menopause at
Mhm.
25, and it was very intense. And the only education that I got was this is going to be rough.
So I would just add that the process your body was going through was something that it really wouldn't have gone through until you were older had you not had this medical issue that you had to take care of. So I would say that, in your case, although you were physically 25 in terms of age, your body was going through the change that women usually experience in their 50s and sometimes 60s. So I would say that it's not necessarily your chronological age. It is the body processes that you are going through. And, women go through these processes at all different times. My mom didn't go into menopause until later, like she was on the later edge, whereas some women start experiencing perimenopause symptoms in their late 30s. So we're all different as women. Our bodies are not cookie cutter. So it's really paying attention to what your body is going through. And if you're saying, well, I'm 25, but I'm having the symptoms of somebody who's in their 50s because I went through this medical procedure, then cannabis will work for you the way it would work for somebody at that age who's going through those experiences.
Why can something that worked, and I think you just kind of answered this, but we'll dig into it a little deeper. Why can something that worked well for a woman that's in their 30s feel so completely different when they reach 40 or 50?
Well, it's really about the change in our bodies, right? So our metabolism changes, our hormones change, our tolerance for different things changes. And women, because we are so, I don't want to say controlled by our hormones, but because hormones play such a huge role, just like our ECS, in regulating a lot of things like mood and pain and sleep, as those things change, our experience with our external world changes and our experience with our internal world changes. And this, I had thought of an example for this that doesn't just relate to women, but I think relates to everybody. In my 30s, I was a runner and I loved running. And I would go out and run 5 miles, and it was great. And my body felt great. And I had endorphins and endocannabinoids. And I was like, this is fantastic. And then somewhere in my late 30s, I started getting joint pain, hip pain when I would run. And it was uncomfortable. And my doctor was like, stop running. And I said, but I don't want to stop running. I love it. I get so much from it. He's like, yeah, but your body is telling you that it no longer enjoys it, that it's reached a point where that activity is not resulting in something your body is enjoying. And so I had to give it up. And I had to shift to something else that was not going to have the same impact on my body. So we all go through this, right? There are activities that we do, whether it's running or just crouching down to pick something up off the floor, that is really easy for us at some time in our life. And then at some point, it becomes harder and harder and more difficult. And now we're kind of like bracing ourselves as we go to the ground. So we all experience this, and our bodies need different things at different times. So I think it's not judging yourself for not being able to do the things that you could do when you were younger, and not judging yourself for not feeling the way you felt when you were younger. It's recognizing that you feel different, but it's not worse. It's just different. And we're going to talk about this later, but there's also a lot of benefits that come with getting older. And there's a lot of benefits for women that come with getting older. We're not taught to feel that way, right? Because we're taught that once we can't make babies, it's like, all right, next. But that's just not true. So I think that we do change, our bodies change, our attitudes change as we age, and that's okay. And so it's finding and thinking about what you need in this day to day to feel like the best version of you.
That's what we want everybody to do is be their best version of who they are and
Yeah.
live their best quality of life today.
Yeah.
The endocannabinoid system also changes over time as you age. It's not just your hormones, your endocannabinoid system changes as well. So, and they may not be making the same changes at the same time,
Oh,
correct?
absolutely. So, one of the things we see, especially for women, because of the role of both hormones and the ECS, is a change in cannabis tolerance. And, I really want to do a study of women in cannabis because we're going to get to this, but there is just nothing out there outside of women in pregnancy in cannabis, which everybody's very concerned about. But like everything else, it's like men. And then it's like, well, how can we shift this to think about women? But women are so different in how they age and what's going on internally that your tolerance to cannabis can change drastically. And I've heard this is my experience. I've heard this from other women as well. I had a very high tolerance for cannabis. I started using cannabis in my late teens, early 20s, and I always had a very high tolerance. Like it wasn't like it had to build up over time. It was like from the go. I could consume a large amount of cannabis and never worry about any negative side effects. I never got anxious. I never got overwhelmed. I never worried if it was too much. I was like 100 milligrams of THC and go to the gym. That was just my body chemistry. As I got older, that changed. And it didn't change because I stopped using cannabis for a while and went back to it. It just changed. And all of a sudden, it felt I did get overwhelmed and I did get anxious. And there was an amount that was too much. And I had to really think about what that meant for me as a consumer, what was going on with my body, why it was acting like that. And instead of just pushing through and saying, well, I'm just going to keep, the same amount anyway, I completely changed my relationship with cannabis. And I think that women, especially, have to be prepared for that. And it doesn't mean we can't get the benefits of using cannabis. It just may mean that it looks different, right? That it looks like 2.5 milligrams of THC instead of 50 milligrams of THC. I stopped smoking cannabis because I was noticing after doing it for so many years, I was having negative effects. I was having negative effects on my voice, on my skin, on my teeth. So, when you get older and you've been doing something for a long time, you have to take into consideration what the healthiest way to move forward with that activity is.
There's 3 points I want to make from that you just said. First and foremost, I would assume that the levels of THC and the quality of products changed over your lifetime as well that you were consuming from when you first started to when you started noticing differences. Would that be?
Um, I would say the flower, yes. So, I started using cannabis in the mid 90s in Texas. The quality we were getting was not great, but I also moved to the Bay Area of California in 2002. So, starting in 2002, when I was 25, I had access to very high quality cannabis products, very high potency flower, dosed edibles. So when I say I took 100 milligrams and went to the gym, like that was 100 milligrams of tested cannabis. I was smoking 25% THC cannabis throughout the day, teaching classes, doing things. So yes, at the very, very beginning of my cannabis use, the products were definitely inferior, and it was all flour. But I started on high quality, high potency products pretty early because I lived in California and had access to them.
The other piece of that is that, and I've written about this before, is that women's bodies and men's bodies are not the same. And the research that we base most health information off of is based off studies with men. Even though we've passed laws that women, excuse me, women must be part of a study or there must be more women inclusiveness, we still see that most representation for what we decide to do with health is based on studies off of men. And I think it's time we start doing studies just on women and fully understanding the whole cycle of the ECS and hormones and the impact that it plays on our body. I
So
can't
uh,
wait for
I
this.
so I just want to say something about that because this is a pervasive issue in research in general. Cannabis is not alone here. A lot of the health research that is done on men. A lot of, experimental therapies, men. And there's a reason for that, especially when it comes to drug use. One is that with cannabis, because it's a Schedule One drug, we don't really have studies where we're giving people cannabis, right? It's very hard to access it for research purposes. We're not allowed to use the cannabis that's being sold in dispensaries. So a lot of survey research and human research around cannabis is asking people about their cannabis use. And women have very good reasons to not want to discuss their substance use. And one of the main reasons is that they are usually the primary caretakers of children. And so, talking about substance use and the role that we have established in society of the connection between substance use and parenting ability and responsibility makes it so a lot of women just don't want to talk about it, even if they're using it, even if it's anonymous, because they're afraid it's somehow going to get back to CPS and it's going to impact their relationship with their children. So that's one reason we don't see a lot of women studies with women. Another reason is, and I alluded to this before, is that we look at women who are of childbearing age as a protected class. So there is a lot of fear that if we're doing a clinical study and we're trying to measure the impact of cannabis on something, if we give that cannabis to women, even if they're not pregnant, but they're at an age where they could get pregnant, or maybe they could get pregnant in the future, that we are somehow jeopardizing their fertility and their ability to get pregnant and have healthy children. And so there is a lot of reluctance and sometimes legal inability to include women of childbearing age in certain research studies. And so we end up going and doing the studies on men. And then we say, well, if it's this way for men, it must be this way for women. I mean, the fact that we still think that we can translate research that's done on men's bodies to women's bodies in 2026 is pretty ludicrous. But that's really the reason why we don't see more research being done with women. Now, things have changed in terms of the stigma. And women feel more comfortable now talking about their cannabis use because it's legal. However, could be a reluctance among mothers to talk about their cannabis use because, again, they're the primary caretakers. And so there's definitely a double standard. The mom has to be there watching the kids. The dad could be in the garage smoking joints, and it's like, that's fine. But if it was the other way around, it might be like, well, why isn't she parenting her children? So it's unfortunate. The double standard for women and men, both biologically, psychologically, sociologically, weaves its way through our ability to get good data on women in cannabis.
And some states have laws that if you are a mother and or a family, parents in general, and you consume cannabis, they can take your children away. So,
Where it's illegal, yes,
yes.
absolutely. I was just going to say, when we passed Prop 64 in California to legalize cannabis, we included in there that if you are a medical cannabis patient, that cannot be used against you in custody hearings, divorce proceedings. And that's rare. Like in a lot of states, even when you are a medical cannabis patient, like bona fide recommendation from your doctor, if you are going into a custody battle, they can use your cannabis use against you. to justify not giving you full custody of your children.
If you're going to be open about your cannabis use with anyone, make sure you're aware of what your laws on your state and what jeopardy it could be putting you in, because we do not want to see families split up for somebody that's using cannabis medicinally to improve their health and quality of life, to be the best parent that they can be. So, what happens when men aren't educated about women's hormones, and how does that affect relationships, workplace, and care?
I was thinking I should probably get my partner in to answer this question and be like, so honey, how does it affect you when you don't understand my hormones? I think, again, I go back to society, where the societal kind of word on the street is that hormone impact is just mood. It's just like, oh, she's in a bad mood because her hormones are acting up, almost like PMS on hyperdrive, right? So it's like, okay, women, PMS, oh, there she's in a bitchy mood, better stay away from her, that kind of thing. And I think that that follows through into perimenopause and menopause, where it's like, oh, she's just going to be on having PMS forever now. It's so different than that. I mean, yes, mood regulation is part of it, but it's not just, oh, I had a bad day and stay away from me because I'm in a bad mood. It's really feeling not like yourself. And when you felt like yourself for your whole life, and now you feel disconnected to that kind of inner being of who you are, it feels weird and it gives you anxiety and you want to get it back and you don't know how to do that. And so I would say there's this underlying disconnection that then is coupled with being anxious and, being depressed and, feeling like you're don't have any patience. And it's also, libido and not having interest in sex, which is really hard to explain to a partner. I love you and I'm attracted to you, but I'm not like wanting to have sex because I just don't feel the urge inside me. I mean, our bodies are designed to make us feel those urges so that we will have sex and have children. I mean, that's, we can glamorize it all we want, but at the end of the day, your hormones are saying, hey, it's time to fertilize an egg in you so that you can have a baby. And when that is off the table, a lot of those desires go off the table. Hollywood and, they glamorize sex as being this amazing experience for women every time. Well, I'm here to tell you it's not, right? I mean, intimacy is great, closeness is great, but when you get older as women, that urge to like actually have intercourse changes. And so it can be hard for a partner to understand that and to not take it personally. Like that's really tough. And there's a whole industry out there to try to make women feel like they want to have sex in their 40s and later. I know because I am their target audience, and like every other Facebook ad I see is for some kind of potion or pill or cream. It's like feel young again in the bedroom. And so I think we have to make it okay to change that relationship. And I think that men have to understand that like it's not about them. Like, what we go through in perimenopause and menopause is about us. It's about how we feel inside. It's about how we feel about ourselves. It's about how we feel of our place in the world and what that means as we get older. It's dealing with physical limitations that we didn't have before. It's dealing with sleep and psychological limitations and fuzzy brain and why the hell did I walk in this room and waking up at 3 a.m. and being like, oh shit, I'm going to be awake now for the next few hours, getting up to pee a million times during the night. Like these are all things we're dealing with that are strictly about us and our relationship with ourselves. So I understand how that can be anxiety provoking for partners and bosses and friends and coworkers and children and other people in our lives who are used to us being a certain way. But I think the biggest takeaway I would have for those folks is that just keep reminding yourself it's not about you. If they're acting differently towards you, if they seem different, if they seem stressed out, it's because they are dealing with not just like storm cloud, but like a whole atmospheric river cyclone, you know, of changes that change from day to day and that our society doesn't really care about. And we've got some limited things that we can do. We have HRT, right? Hormone replacement therapy. We've got testosterone therapy. We have creams and potions and all those things I mentioned before. But we haven't, as a society, really said, you know what? Let's help make this time better for women.
100%. I can tell you, as you're telling that story, I'm sitting here thinking at 25, ripping me and taking everything out of me that what most people would say make you a woman. I thought the body snatchers had come and taken me away. That's a movie. I don't know if anybody's familiar with it,
Yeah.
but
Oh, I know it.
I thought, oh my gosh, I don't even know who I am. I mean, you go through this experience of who am I yourself? Not that, not as everybody else is questioning who you are, you're going through it in an extreme method with all the things that are going on because nothing makes sense. And I think it's really interesting because we did the women's issue last year, and our head editor and outreach person for the newsletter is a male. And he says, "Oh, I don't have any input to this." And I said, "You're the head editor." "Yes, you do." And so we had all these pieces of content that he had to read, and he was like, "Oh my gosh, I didn't know all this stuff existed." And I said, "This is the problem. We don't include you in the conversation."
Yeah.
And he said, "I learned so much in doing this issue." And I said, "We don't even have these conversations with our girlfriends a lot of times, much less with men,
Yeah.
because we don't want to be judged. We don't want to say, oh, just put your big girl's panties on and deal with it, whatever it may be." And these are conversations that we have to have. And he
Oh,
was like,
100%.
"Thank you," at the end of this, because he said, "I understand now what other women around me are going through, and I didn't understand that before." And he's in his 40s. So
Yeah. I agree 100%. I remember sitting around with some girlfriends of various ages when I was in probably like my late 30s. And I remember we started talking about what's going to happen, like what happens. Like we were asking the women who are older, like, what's going to happen? And we realized that we don't have those conversations, right? Like we barely have conversations about getting your period, right? It's basically like, well, you're a woman now, like here's some tampons. But we just do such a horrible job about being really open and honest about what women go through, even around amongst each other. You know, you're absolutely right because we are conditioned to not talk about these things. You know, traditionally, women just didn't talk about those things, right? They just silently went about their business and took care of the kids and whatever they needed to do. But I'm hopeful that, you know, the next generation, the generations coming up behind us, are going to feel more comfortable having these discussions about themselves and their bodies and what's going on and not doing it from a place of shame.
that's what's wonderful about these conversations that we get to have and get to talk about this stuff and bring it forward, because we want these conversations to be empowering, and we want them to bring the opportunity for people to have that talk with someone and be understood,
Yeah.
not judged. There's a
Yes.
big difference there. We want to be understood. Doesn't mean you have to know exactly what I'm going through, but just, understand I'm going through something and I need to have someone to just listen to me, even if you don't understand.
Yeah. 100%.
Uh, if a woman says, "I suddenly don't feel like myself," how might the ECS be part of that story?
Well, that's a great segue. So, you know, we've talked about before the ECS is a regulator and it regulates a lot of the major things that happen with our bodies. It regulates our appetite, it regulates our mood, it regulates pain, it regulates libido. So, as we get older and our hormones are changing and our ECS is changing, there's a lot of unbalance happening with the body, right? So, the endocannabinoids that our ECS has been releasing may slow down, it may change. And a lot of times when we see a change in tolerance, that could be related to changes in the ECS. So, before bringing in a lot of phytocannabinoids and not having the same effect as it has when you're older and not having the same risks and negative experiences when you're younger as you do when you're older is absolutely related to the functioning of the ECS. So again, going back to homeostasis and balance, as we get older, it becomes harder to keep our bodies in balance. So if you think about walking on a balance beam, and when we're younger, that beam is this wide. And we're just walking along, and if we happen to stumble or something, we're still on the beam. We're good, and then as we get older, it's this wide, and we're like, all right, I gotta be a little more careful now. My balance becomes more important. And then as we get older, it's this wide. And it becomes really hard to stay on. It becomes really hard. One little thing just knocks you right off because you're already out of balance. And so I think that, one of the things we don't really have that I know people are working on, and I've seen some of these kits. I'm a very pessimistic person when it comes to claims that companies make about their products. But I do think that the ability to really assess the functioning of your ECS is going to come in huge in the future. And not just for things like menopause and perimenopause, but for things like MS and epilepsy and other conditions that are diseases of dysregulation in the body, and really understanding the role of the ECS in the development of these diseases. But going back to menopause and perimenopause, but to be able to measure our ECS throughout our lifespan, our personal ECS. So not like, here's an ECS system. Amanda, how do you compare? But like, all right, let's test Amanda's ECS when she's 5. And then let's test it again when she's 10. And then let's test it again when she's 15. And continuing to do that throughout your lifespan so that you can identify what is changing. And then we can develop therapies to help balance the ECS. I mean, that is really what cannabinoids, phytocannabinoids, are good for. We don't really know what they're doing other than what receptors they're binding to and the effects we're getting from it. But if we're able to say, okay, Amanda, we noticed in your 35 assessment of your ECS that your anandamide levels are starting to drop off, which is the endocannabinoid that is the same as THC. So we're going to recommend a THC supplementation regimen of 1 milligram per day to help balance out this reduction in anandamide production, because anandamide helps with mood, it helps with pain. Like, that's where we need to get to. Like, cannabis is great as a mood enhancer, as an appetite enhancer. It's great for all those things, but there's so much more we could do if we were really able to measure the functioning of the ECS in an individual over time and identify when we start to see an imbalance in the way the ECS is functioning, so that we can then supplement that with phytocannabinoids.
So do you believe that's possible? Because I definitely do.
Oh, 100%, 100%. And Dr. Ethan Russo, who's a good friend of mine, lives here in Washington. He's really spearheaded this concept of endocannabinoid deficiency syndrome. And his theory is that some of these diseases of dysregulation that I mentioned, MS, epilepsy, cancer, could actually be identified before the disease state presents itself by understanding endocannabinoid deficiency, and that some people are born with the inability to produce certain endocannabinoids to the point their body needs them in order to maintain homeostasis. And if we understood more about that in each individual person, we would be able to supplement what they need so that maybe they don't develop these diseases. And I'm not saying we wouldn't get menopause or perimenopause, because I think our bodies are changing in ways that, it's our hormones as well as our ECS, but that's what HRT is. I mean, I'm on HRT, right? So I take estradiol and progesterone to help balance and eliminate some of the symptoms of perimenopause. And that's what it's doing. Like my little patch right here, right? It's saying, hey, Amanda, your body is not producing this hormone as much anymore. So we're going to give it to you from an external source so that you don't have some of the symptoms that are associated with a reduction in this hormone. And so if we are able to do that with the ECS, I think we would really be able to enjoy a more healthful aging process.
And I think that's a really important part to talk about here because when I was 25 and had my hysterectomy, they immediately put me on hormone replacement. And I was on it from 25 to in my 50s. And then all of a sudden, a doctor looked at me and said, "Oh my gosh, how long have you been on hormone replacement?" And I said, "I've been on it since I had my hysterectomy." He said, "Oh no, this is horrible. It's been proven that you shouldn't take hormones for a very long time. We don't need it anymore." So they stopped it immediately, which didn't really have an impact on me because I'd been on it for so long, but I had no side effects from being on hormones all this time. But from my experience of going through that, there is no way that anything else is going to help you through that without hormone replacement. I can't imagine having gone through that period without that.
Yeah.
And so now I know we've changed the stance on this, that we do use hormone replacement and you can use it successfully with cannabis. And it can help you with sleep, anxiety, stress, mood, everything. The
Yeah,
combination of the two pairs well, very well together.
I
And
agree.
I
Yeah.
think it's really important that we're having this conversation and sharing this now because women need to know that it's not one thing fixes it all. There's multiple things that we need to be using when we're talking about this.
Oh, absolutely. And I think that speaks to what we were saying before, which is just we have not focused on women's health in the research world. And, we only discovered we had an endocannabinoid system in the 90s. So, that story gets less exciting every time I tell it because I used to tell it in like the early 2000s and people were like, now they're like, with the 90s, wasn't that like 40 years ago? 30 years ago? But I mean, we haven't known about it that long. I mean, considering that it plays such an important role in our health and well-being, akin to our nervous system, the fact that we haven't known about it for that long means there's so much more to discover. And of course, with cannabis being a Schedule One drug, that impacts not only research on cannabis, but it impacts research on the ECS. We still don't teach about it in most medical schools, or if we do, it's like very, very brief. I've heard from doctors who are trying to get it introduced into medical school that the pushback they get is, well, if we teach about the ECS, we have to not teach about something else because we only have so many days. And I'm like, that's such a piss poor excuse for not teaching doctors about a system that is so important to our health and well-being. So, yes, I think we need to do more research on the ECS. We need to understand ECS supplementation. We need to understand the connection between the ECS and hormones. I started using CBN at night for sleep, and it's been amazing. I mean, the 3 a.m. wake ups, gone. And it doesn't get me high. I don't feel groggy in the morning. I'd much rather take that than Ambien or another sleep aid. So I think it's not even just understanding the ECS, but it's helping women especially understand that there are so many cannabinoids out there and they serve different functions. It's not just, well, I'm not going to take cannabis for sleep because I don't want to get high. There are so many options for cannabinoid therapy that are not intoxicating at all.
And I think there's a couple of good points there that you've made that I want to highlight a little bit on. Yeah, we have known about the endocannabinoid system for maybe 30 years now. The biggest problem is we don't educate on it. Can you imagine when we learned about the cardiovascular system or the respiratory system and we waited 30 years and still it wasn't included in their medical training? That's where my outrage comes.
Yeah. I
Because
agree. Yeah, I went to my OBGYN last year to talk about HRT. And the nurse was asking me, doing the intake and everything. And she's like, so what do you take? What are your medications you take? I said, well, I take CBD every morning for an autoimmune condition that I have. And she was like, what's CBD? A nurse, a nurse at a gynecologist's office. What's CBD? And Washington, where cannabis is legal. Like I almost fell out of my chair.
I think there's more of that than we even realize because of us that work in this industry. We talk about this all day long, every day. We're always communicating about it and we're talking to other people that know about it. So when we walk into a medical professional's office and mention it and they've never heard of it, I'm just stunned like you are, and it makes you stop in your tracks. But that just goes to my point. We are ignoring a system that everybody is born with that plays a critical role in your health. I don't care how you want to say it to me, it matters.
Yeah.
And this is where the outrage should be for everyone, is that
Absolutely.
you are not getting the best medical care you can get because they're not taught about a system that needs to be included.
100%.
Yeah. And I don't mean to get so
No,
upset
we
about
should
this,
be
but
angry
you
about it,
need to
Debbie, and
be.
not just because we're menopausal and perimenopausal. We should get angry about it because there are women, girls being born right now who could benefit from this knowledge as they get older, as they, get into womanhood. And if we don't advocate and get angry about the fact that this is not being done, they are not going to benefit from it either.
Right. And the other part of that is you were talking about people being born with a deficiency in their endocannabinoid system. So what does personalized hormone aware cannabis use actually look like in real life, not theory?
I would say the same as any cannabis use, right? It's really about what's right for you and not paying attention to what's right for someone else. And the fact that we have an endocannabinoid system that's everyone's is slightly different. The fact that we have hormone production and that's slightly different for everyone. What works for one person isn't going to work for another. And what's worked for you, as we mentioned before, 10 years ago may not work for you today. What worked for you 5 years ago or 1 year ago may not work for you today. So, what I really encourage people to do is to bring mindfulness into their consumption and really thinking about what am I trying to accomplish with consuming this right now? And did I accomplish that? And how close did I get to accomplishing that? So, you might have, maybe you are having a mood issue and you're like, cannabis is going to help elevate my mood. And it's a great mood elevator, right? ECS helps regulate mood. So you take some gummy and you think to yourself, I do feel better. Like my mood is elevated, but I also feel kind of out of it. And I don't like that part of it. I just like the elevation. I don't like the feeling out of it. So what can I do differently next time? Is it that I took too much? So if I took 5 milligrams, maybe I try next time with 2.5 milligrams. I take something that was really heavy in THC. Maybe the next time I look for something that's less in THC and higher in something else. I'm a huge fan of tinctures because with tinctures, you can really dial in that ratio of cannabinoids. It's almost like a formulary, right? So you can say, I want something that's 30-1 CBD THC and really figure out how to take what you need. So I think it's a journey for each person to figure out what they need for what they're trying to treat. So what you take for inflammation might be different than what you take for sleep. And it's work, right? Because we don't have doctors out there that are like, oh, sleep, take 10 milligrams of CBN. Oh, inflammation, take 600 milligrams of CBD. We have to figure that out for ourselves. Now, luckily, unlike a lot of other pharmaceutical medications and even a lot of over-the-counter medications, the risks are fairly low. Even if you overdose on THC, it's going to be uncomfortable, but it's not going to be dangerous or fatal. So you might feel dizzy, you might feel anxious, you might feel overwhelmed. It will pass. But take note of that, right? Like, note to self, 10 milligrams of THC was too much, right? So the next time I'm going to cut that in half or I'm going to cut that into a quarter and try that. So I think hormone aware care with cannabis is just cannabis care. It's not different. It's being aware of what you're trying to treat, paying attention to what you're consuming, how you felt, whether it accomplished what you wanted it to accomplish, whether there were additional effects that you didn't like, and then keeping note of that so that next time you can adjust. So, we talked about all kinds of different symptoms that are associated with menopause and perimenopause, and you may need different cannabinoids for different symptoms. So, inflammation, you might need CBD, sleep, you might need CBN, mood issues, you might need THC. So, one of the benefits of legalization is that unlike just having a baggie of weed and smoking it to see if you feel better, people that have access to dispensaries can go and seek out very specific types of products. So that's really is my recommendation. That's always been my recommendation. Even when I used to do these talks 20 years ago, was keep a journal. There's a great app that I like to recommend called Tetragram that you can download where you can track what product you used. You can even take a picture of the label. You can say how much of CBD and THC and whatever's in it. You can say when you took it, how you felt, and that's really what's going to help you figure out what's right for you personally.
Well, I learned cannabis is a teaching plant. If you allow yourself to listen to what your body's telling you, it will teach you a lot about yourself. And I'm actually writing a course right now for that of how to write your own health story and understanding and learning how to listen to your body because that's something we're not taught. And that's something that we need to be taught. And it's something we should teach from very beginning is how to listen to your body. What is it telling you? What are the options? What should I do? We teach our kids to read, to tie their shoes. We could teach them to be more in tune with their body. I would have given anything to have had that training as a younger person and not live with all the health conditions that I live with today and struggle with that could have maybe been reversed or prevented if I'd have had better knowledge.
I
So I
love
think
about being a teaching plant because I think that's one of the things that separates it and a lot of psychedelics from other intoxicating substances is that, when you think about alcohol, when you think about opiates, there's like a using it to separate from yourself, right? Separate from your pain, separate from your depression, to not be connected to your body. And cannabis and a lot of psychedelics work in the opposite way. They help you to connect with your body and understand what your body is going through. That can work to find something that's going to help ameliorate a symptom or treat a condition. But I love that concept of it being a teaching plant.
I can verify for sure here about the difference between pharmaceuticals and cannabis when it comes to that. I was on opioids for over 3 decades at very high doses to control my pain. And it was actually blocking my ability to think.
Mhm.
And someone could ask me a simple question, where do you want to go for dinner tonight? And I couldn't even answer that question. I was struggling to find those thoughts. Once I removed all the opioids, introduced the cannabis, and I don't have that problem anymore. And it opened up my mind, and I know more about myself today than I ever did on any of the pharmaceuticals that I was on. So, they serve a different purpose. I'm not saying that we don't need medications still. We do, just like hormone replacement therapy. But there are other alternatives for some pharmaceuticals that we have that cannabis should be the first choice.
Oh, 100%. And just the way that we're using them, right? So, I mean, opiates are valuable. I've used them when I've had back surgery, but they are valuable for a brief period of time when there is very severe pain following a surgery or an injury. They are not meant to be something you take regularly into the future. They never, ever were. And we didn't use them that way because we felt we didn't have an alternative and because so many people have pain. But really, if you're looking for something that you should use regularly into eternity, it's something like cannabis that has a very low risk of dependence, has no risk of fatal overdose, and is helping keep your body in balance rather than just blocking a signal, which is what opiates do, right? So I think, yes, opiates have their place, but we do not use them correctly in society. We do not recommend them correctly. And, we could go into a whole thing about the role that the opiate companies play in that whole mess, which we will not because we're talking about cannabis.
Right. And I also think with the experience that, when people start with cannabis, they're expecting the same outcomes that they expect with pharmaceuticals. Someone hands you a pill, you take it, that dose worked, it didn't work. And so then they get discouraged and don't try again. When you were talking about you can decide what dose works best for you, that's the other part about this teaching plant is that you can discover, and I always recommend that everybody start with a very small amount and work yourself up versus starting at a high amount and working back down. But I think that it's really important that we understand that the whole concept about how we approach cannabis and talk about cannabis as medicine or as therapeutics, or even if it's for adult use, we need to be talking about it's very different than any way we've ever thought about using something and introducing it to help us feel different with sleep, mood, anxiety, whatever it may be.
Absolutely. Absolutely. I mean, cannabis is very multifaceted because we are very multifaceted as people. So it's really like instead of just using a hammer for every job in the house, whether it's sawing something or hammering something or painting something, you're like, well, I've got a hammer. Cannabis is a toolbox, right? So it's like, all right, let me think about which tool is best for what I'm trying to accomplish. And if it's like, oh, that hammer was too big, that nail is small, that didn't work, I'm going to choose a smaller hammer. And so I think that remembering that cannabis is multiple tools for multiple jobs versus one tool that we try to use for everything. That also, I think, brings in a more mindful approach.
Let's talk about advocating now for ourselves and for other women. So, how can women advocate for themselves when their provider is unfamiliar or uncomfortable discussing cannabis?
So that is tough. And that's something I've been counseling people on for a long time. And I kind of wished after 20 years I didn't have to counsel them on that anymore because doctors would know about cannabis. So there are a lot of doctors, especially specialists, that do understand cannabis, pain specialists, cancer specialists, like oncologists, because they have a heightened patient population that is using cannabis. And because the options for treatment are very harsh and evasive for these conditions, they are more likely to understand cannabis. But if you go to your general practitioner, your gynecologist, somebody that's not necessarily specializing in a certain area of medicine, it's very unlikely that they're going to understand medical cannabis. So, what I recommend, and I'm still recommending this, for 20 years, is find some good journal articles online that really speak to cannabis for your condition, if that's possible. So if you have MS, if you have epilepsy, if you have sleep issues, if you have pain issues, try to find some research. Don't pretend that you're going to educate them because doctors don't like to be educated by their patients, unfortunately. But tell them that you are very interested in using cannabis for your condition and that you understand that cannabis and the endocannabinoid system is unfortunately not something that is usually taught in medical school. So you understand that there's a good chance, as to no fault of their own, that they may not know the research behind cannabis, but you brought some resources with you and you're going to leave these resources with them. And you're hopeful that the next appointment, you're going to be able to have a conversation about it. And I feel like that's the best kind of I'm not trying to school you or pretend that I'm smarter than you approach to talking to a medical professional about cannabis. But that's really my advice. And then educate yourself.
And one of the things we suggest for everyone is just another tool in your toolbox is the newsletter. We write articles about these topics and personal stories. So you can actually, go into your doctor and say, this is a condition that I have. There's this newsletter that's covering this topic. And there's people that are using it for this health condition as well. And so it gives them an idea of the research plus the testimonial of somebody that's using it to have a little bit of view of what it can do.
Yeah.
What's one myth about cannabis and menopausal women that you'd love to retire for good?
Well, I mean, the biggest myth is probably that cannabis isn't helpful for menopausal women, that there is no medical use there, medical value. So I definitely want us to understand that there absolutely is. As we discussed before, some of the symptoms of perimenopause and menopause, including sleep disturbance, mood disturbance, inflammation, joint pain, loss of libido, these are all very specific symptoms that are impacted by a balanced endocannabinoid system. So it would be foolish to say that there was no connection there, right? It's like, oh, with menopause, I have mood disturbance. Oh, the endocannabinoid regulates mood disturbance, but there's no connection there. Like there absolutely is. So I think that's really the biggest myth is that cannabis exists separately from what we experience in perimenopause and menopause because they are absolutely connected. It is more than just hormones. It is a change in the ECS.
All right. If cannabis is supporting balance rather than making symptoms, how does that change the way we define treatment?
Well, I mean, it's both. right? So it's kind of like there's this internal need to bring the body into balance, and that always exists, right? Like I said, even though the balance beam is wider when we're younger, we still need to keep our bodies in balance, right? Something severe could knock us off, even if it's a wide beam. As we get older, that beam gets narrower, then the maintaining balance becomes harder. But that doesn't mean we don't have real symptoms that we don't want to feel. So there's balance on one side of like, how do we maintain balance in our bodies and make sure that our endocannabinoid system is functioning the way it needs to be, or that we're supplementing the endocannabinoid system with phytocannabinoids that are going to help maintain that homeostasis. And there's also, at the same time, I don't want to wake up at 3 a.m. anymore. So I think we need to talk about it both ways because for some women, they are like, I just want my symptoms to go away. Like balance, great, love it. Let's bring me into balance, but I don't want to feel like this anymore. And then for some women, they're saying, yes, I understand that those symptoms are an impact of my body being out of balance. So I believe that if I just bring my body into balance, those symptoms will go away. I think we need to address both. There is no wrong way to feel about how you want to feel better. We all are on different health journeys. And for some of us, we want to attack what's going on internally with how our system is functioning. And for some of us, we just want to feel better, whatever that means for what's going on in our body. So I think it's both.
Hmm. Interesting. I like that take, and I like that you say we all just want to feel better, and that's what we're on the mission to do. So
Yeah.
thank you. So what would you change if we reframed menopause as a transition into wisdom and stability instead of a decline?
Oh, well, I think it's just that, right? I mean, again, we focus so much on women as baby makers that it's like once we're not baby makers anymore, it's like, well, what good are you? Kind of a thing. And I think that's unfortunate. I read a lot of books that were written in the 1960s and earlier, and just the way they talk about women in these books. It's so crazy to me as a Gen Xer, right? And hearing about women, what their role is really the secondary role of caretaker and mother. And I think it is important that we honor and celebrate the changes that are positive in our lives as we get older. I mean, not to be crude, but like zero fucks given, right? Like I used to think so much about how I was being perceived and what I looked like and going out and dressing a certain way. And yes, that was my body saying, you need to attract a man to put a baby in you because biology is saying that's what you should do. I chose not to have children. So I never kind of realized my body's goal reproducing. And I had to then realize it for myself what my identity was as I moved through that time in my life. Because for so many women, they're conditioned to think, okay, your identity is daughter, and then your identity is wife, and then your identity is mother, and then your identity is caretaker. And I was like, I'm just me. Like I have aspirations and goals and my identity is scientist and my identity is dog and cat mom and my identity is community member and my identity is advocate. And we don't lose those identities just because we can no longer put babies in ourselves, right? I mean, I think we want to look at menopause and perimenopause as a sign that we are mature, that we are sage, that we are aged, but in a like, you know, woman on the mountain with a stick and a cape kind of way, right? Not like a go in and we don't want to hear from you anymore kind of way. And I think fortunately, we have a lot of women now that are role models for us. Women who are working hard throughout their life, even into older life, that we can look to and say, they are the smartest they've ever been. They are the most effective they've ever been. That our utility as women does not go like this, right? We've been taught it's a bell curve and that we're at our height when we're having babies and building families. And then when that's over, we decline. And I prefer to look at it like this, right? Through our lives, we are constantly gaining wisdom. We are gaining experience. We are gaining our voice. We are not afraid to use our voice even more as we get older. And I think that that's amazing and that that should be celebrated. And that women don't really even reach their prime self until they get older and they can really shed that pressure of having those identities and kind of come into their own.
Thank you for saying that. As somebody that's sitting here at 68, I like to think that my wisdom is much better today than it was at 25. And whatever road I've traveled has taught me a lot. And hopefully I can share that with other people to give them insight so maybe they don't have to take such the hard road that I might have had to take. So if the endocannabinoid system was treated as a core pillar of healthcare, how differently would we approach aging, hormones, and quality of life for everyone?
I think if we really took the ECS seriously, we would say we need to measure functioning. Like we need to understand how this very important, just like putting a stethoscope on your chest and listening to your heart, right? All the other things that we do in the medical system in order to measure the functioning of things that keep us alive and keep us well, right? We take people's temperatures, we take their blood pressure. I mean, this is all part of saying if something's going wrong with you, this is going to be an indicator that something is wrong and we're going to have to dig deeper, right? Oh, your blood pressure is much higher than it was last time. We got to figure out why. If we looked at the ECS as an actual pillar of health, which it is, we would figure out a way to measure it over time so that we can identify when things change. And that change could mean supplemental phytocannabinoid therapy. It could also mean saying, hey, something could be wrong. Like this is a marker. We see when 5 years before somebody develops MS, we see this endocannabinoid productivity decline in this way. So we need to watch out for that, right? I go to the dermatologist every 6 months to get my moles checked because she's saying if their mole looks weird, it could mean that something's coming that we want to be able to prevent. So it's a hugely important part of preventative medicine and detecting when the body is off. And what we do for that could be a wide variety of things, but we need to be able to measure that over time and really understand how the body's balance changes as we age or how it changes with a disease.
So I hope that we get there sooner than later because I really do think it's going to make a big difference in how we approach health and can make a big difference in the amount of health conditions that we have for generations to come. It really is
Absolutely.
important.
Yeah.
So this has been a lovely conversation. I love when we talk, and I can't wait
Me
to do the
too.
next one. I'm just going to tell you because there's going to be another one. Is there anything that I didn't ask you today that I should have asked and that you would like to share?
Well, I would just end by going back to something we talked about earlier, which is the need for women to talk to each other. And, we talk about a lot of things together. We talk about the people in our lives. We talk about our jobs. If we have kids, we talk about our kids. If we have pets, we talk about our pets. We talk about what crazy stuff is happening in the world today and in our country. Like we talk about these things. We need to talk about our health as well. And that's okay. And it's okay to say, hey, I've been having this weird symptom and I don't really sure what it means. And I don't know if anyone else is having it as well, because we're asking Chat GPT and we're going online and we need to talk to each other. And we need to talk to our healthcare providers, our women-centric healthcare providers about our symptoms and about what's going on. And we're, again, so conditioned to say everything's fine. Put on a smile. How are you feeling? Everything's fine. I mean, the reason that they instituted asking women if they feel safe at home, which you'll notice doctors always ask now, is because women will not offer up that information if they are not asked. So we need to put aside any embarrassment or things we've been conditioned not to talk about, and we need to talk about it. So, for example, I have a pelvic floor physical therapist that I went to see about a health issue, and she hosts a luncheon for women physicians and doulas and physical therapists and basically women who treat women in healthcare locally. And they have speakers. And so she's invited me to come in February. February and give a talk about the endocannabinoid system and women's health. And like for some of these practitioners, this will be the first time they've ever heard about this stuff. And they work with women all the time. So I think we shouldn't assume that people have this information. I think we should talk about it. If you go to your doctor and they say, what medications are you taking? If you are taking cannabis, list it. List it as a medication. Tell them, I am taking 600 milligrams of CBD via tincture every morning. I am taking 10 milligrams of CBN via gummy every evening because we have to normalize it as part of our health regime. And I understand if you're in an illegal state, that can be very scary. And I actually wouldn't necessarily recommend disclosing your cannabis use if you live in an illegal state because of the implications of being a woman and a caregiver. But if you live in a legal state and what you're doing is allowed by law, talk about it. Talk about it with your girlfriends, talk about it with your family, talk about it with your healthcare providers, and talk about your perimenopause and menopause. Things grow in silence. So if we talk about it with each other, we're going to normalize it, we're going to destigmatize it, we're going to shrink it down to an inherently manageable and maybe even enjoyable time of life.
Well, and we find that when we talk about it with somebody that we're friends with, a lot of times they're going through the same thing.
Oh,
And they might
absolutely.
have tried something or knew something or noticed something that you didn't notice. So, I mean, I think it's really important that we have those conversations. I will caution about talking so freely with your doctors until you're sure if they're open to the conversation. Myself personally, I have now on my record has been put that I am considered cannabis dependent, which is not something that anyone should ever be putting in anybody's medical file that's using it for medicine. I keep telling them it's not a symptom, it's not a problem. It is my medicine, and I'm
Well,
fighting
that's
to
what our
get it
next show
off.
should be about, Debbie. Our next show should be about cannabis dependence because it is very tricky business. As you mentioned, people are dependent on their medications. Diabetics are dependent on insulin. We do not
Correct.
call them insulin dependent as a negative. We say this is something this person needs in order to be healthy. But cannabis dependence also exists in the
Yes.
way we traditionally think about it. So that should be our next topic.
Well, it will make it that. So before we close, if you could leave one perimenopausal or menopausal woman with an empowering message about their bodies, the ECS, and cannabis, what would it be?
I would say it's that change is neutral. It's how you react to it that matters. Everything changes all the time, every day, and a lot of times we don't even notice it. So when something's changing in your life, it is an opportunity to think differently about yourself. It is an opportunity to address maybe some health issues that you've been putting off. We've been conditioned to think of this change as negative, but I say the change is neutral. How you react to it is what matters.
Very well put. Mic drop. Thank you.